Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department. And let's talk about this pandemic. Time for our weekly update. And this time they're going to be in two parts. And the second part will include all the numbers that'll come out the next day or so. In this segment, however, where are we as we look at the factors outlined in video 186 for what the winter may look like? The quick summary is cases are on the way up all over western North Carolina. And now we have the Omicron variant. So what does all this mean? Please share this with someone you care about. So our first criteria was community prevalence. And we'll see the numbers in the next segment, but the summary is much of western North Carolina is now back in the red zone. And we are now on the same trajectory, unfortunately, as post-Thanksgiving last year. For Haywood County, over the first 2 weeks of November, we were seeing around 9 new cases a day on average. That ticked up to around 12 to 13 in the past 10 days. In the past 3 days, roughly a week post-Thanksgiving, we're between 26 and 36 new cases each day reported. Next criteria is test positivity. Although many counties in western North Carolina got below the important 5% threshold, and some are still there, Haywood County was not one of them. Never got below 7%, indicating that our reported numbers were probably low. Now Haywood County, as of today, back up above 10%. Next criteria, the other winter viral illnesses. And as we were afraid, they are here this year. RSV continues to be more widespread. That's a big issue for kids, especially newborns and neonates. But also showing up in adults as bronchitis. Strep throat is increasing. Flu cases are being reported, but have not really taken off yet. Next, what about what's going on around the world? And you can see that cases in Europe continue up, especially in Eastern Europe, where the vaccination rates are low. Next is the local healthcare capacity. Cases at Haywood Regional Medical Center are up quite a bit already this week. They were down to around 2 a week or so ago. Today, they're back up around 16. And after a very few brief days decrease in severe illness and people on ventilators, that's now increasing too. Deaths among our fellow residents continue to be reported, and in fact, for the pandemic, Haywood County now has the 6th highest death rate in North Carolina. And finally, the risk of variants. In May, you will recall, Delta was raging in India, and it took 2 months until July to get here. Omicron just recognized in the past 2 weeks, and if it follows that trajectory, we could look for it to be widespread here in January. But that also assumes it turns out to eclipse Delta. You see, although it is spreading fast in South Africa, for instance, they were having very low case rates before its emergence, so it had very little competition. There is still plenty of Delta here, so we will see which predominates. Omicron has 30 mutations on its spike protein. And of course, the spike protein is what it uses to attach and invade cells. Previous variants had more like 8 to 10 variants. The concern is, will these mutations enable Omicron to latch onto and enter cells more easily? And will the antibodies from acquired infection or vaccinations still be able to latch onto the virus effectively? Questions we still do not know the answers to. So far, illnesses reported in South Africa are mild or moderate. And so far here in the United States, those vaccinated who've been infected have reported mild symptoms. But the outbreak is right now in South Africa affecting younger ages, so we really don't know how much severe illness it will cause. Again, these are all questions that we'll get more information on over the next 2 to 3 weeks. So, what does all this suggest about where we are headed for the winter? Well, cases are up, test positivity is up, other viral illnesses are up, cases around the world are up, healthcare capacity is down, hospitalizations up, deaths continue. Unvaxxed and those with no immunity bearing the brunt. On each measure, each criteria show unfavorable trends for our winter. And so right now, your attention should be on Delta. We know the vaccines are effective against it. It is still the predominant strain here. We know the protective measures you can take that help. When you go out and about, especially in crowded places, if there's poor ventilation, around those you can't know how careful they are being, proper mask wearing, distancing, limiting your time of exposure, and good hand hygiene are really important. The best thing we can do right now is to be careful, whether you're vaccinated or not. If vaccinated and it's been longer than 6 months, get a booster. It raises your immunity levels by a lot and gives you even more protection, especially from serious illness and death. If not vaccinated, how safe should you feel? Well, in Haywood County, if you are one of the roughly 12,000 who have no immune protection, meaning you were never infected or not vaccinated, or infected but it's been more than 6 months, you are at the most risk. Delta and Omicron are coming for you. 98% of new cases this past week were in people not vaccinated. The hospital reports that those showing up in the emergency room are largely not vaccinated, younger and sicker. This is no speculation, just a fact. Getting our cases down right now, ahead of what might happen, can only serve us all well. So be well and be careful, especially right now. Oh, and by the way, my buddy, back upside down.